Let me invite onto the show today for our conversation on the sustainability of our local healthcare system, Dr. Rajesh Patel. He's the head of benefits and risk at the Board of Healthcare Funders. Dr. Patel, good morning.
Good morning to you and the listeners.
Also in the studio, Dr. Nthuthuko Bhengu, CEO and founder of Alchemy Health Technologies. Dr. Bhengu, good morning.
Good morning, Kathy. Good morning, listeners.
We're also joined by Christoff Raath, who is joint CEO of Insight Actuaries and Consultants. Christoff?
Good morning, Kathy. It's great to be here.
It's great to have all of you here, and I think for a really important discussion, because healthcare is something that all of us need. And I was saying earlier that the conversation around universal healthcare, I think at least, that it's not about whether or not we need universal healthcare. I think the world agrees on the fact that we need universal healthcare, but it's about how do we get universal healthcare? How do we make healthcare accessible to all people who need it? And unfortunately, the picture that has been created in this country, especially even under the COVID-19 pandemic, is one of a declining state of our healthcare system. Dr. Patel, in your view, if you were just to describe where you think the state of healthcare in South Africa is today, what would you say?
I think the bottom line is we have a national health system that everyone can access, which is the public sector. The biggest problem I think we've had is from 1994 till now, per capita, we haven't been allocating sufficient money for healthcare services. So essentially there's been a dilution in the money allocated, and there's various reasons for that. We can explore it a little later. But I think because there hasn't been sufficient money allocated, particularly in the public sector, you're getting this big divide between the private sector of those people wanting to try and buy their own medical care services and the public sector, and you're getting this divide that's getting wider and wider and wider. And I think that contributes to the big issue that we're facing in this country.
If we are to unpack why it is that there hasn't been enough budget allocated towards this, where would you say the problem lies?
I think looking at the health system as well from perspective is leadership. Do we have the right leadership? Do we have the right management in place, etc.? And part of the big problem is also the bloated public sector service that we have in the provinces that need to be considered in this regard. But I think leadership is absolutely critical. In the early years with Dr. Nkosazana Zuma, Dr. Mantusha Blamsimang, in many respects we had strong leadership who drove the agenda, who prioritized important reforms that you needed to implement. However, in the last 15, 20 years, you really haven't seen that strong leadership coming through, driving agenda of reform, reallocation and distribution, the whole universal healthcare coverage issues. You've seen like you're taking one problem at a time and trying to work on it and really not finding the overall solutions for the country.
I want to explore that issue of leadership further so that you can break it down for us in terms of what these reforms, what you mean when you talk about reforms. Dr. Bhengu, let me give you a chance to give your own perspective on what the state of healthcare is in the country right now.
Yeah, thank you very much, Kathy. And incidentally, this was the topic I had to cover at the conference. And my response really, I think, after giving the presentation at the end, I said, according to my assessment, our state of health is in high care. Obviously, the ICU being the worst, and beyond that, of course, we're talking mortuary now. But this was really based on, I looked at the model that's used in assessing health systems across many countries. And this is a model that looks at leadership and governance. It looks at the health workforce. It looks at information systems, medical products, which would include your vaccines, medical devices, and also the financing of the health system and how that basically gives us service delivery. So it's basically a failing mark, which I gave. And I must say here that this is obviously based on my view as an informed, not only user, but a policy advisor in the industry and active in the private sector as well. And I basically am convinced that, and I used indicators that are known in the industry, either mainly because of what is published in the annual reports of various entities, the health market inquiry, of which I was fortunate to be a panelist over more than 5 years, and a lot of debates in the industry. But certainly on the leadership side, I did say that I think both in the private and public sector, on paper, we've got people who are quite qualified, but whether that translates into governance that's appropriate, I think that's where I had an issue, and overall I said, well, that's a failing mark there, because you have to look at the level of corruption, and was very careful to say that it's both in public and private sector, and that is very much linked to the issues that we see in poor service delivery. On the financing side, I did say, of course, we're not where we should be. If I were to have a slight difference with Dr. Patel, I'm less likely to say we underfunded, but I would say we're not using the funds we have correctly in a cost-effective manner. And my reason is we've always allocated 8.5% of our budget towards healthcare, but that's still higher than what the WHO recommends. But our outcomes are certainly not the best given what we spend. So we have to make good use of what we have available in terms of healthcare. And then, of course, the issue of workforce is a real one. It is true that we don't train as many of healthcare service providers as the country needs, but that's not really unusual. There's a shortage almost everywhere. That's why there's so much migration. And that forces government in certain ways. On one side is basically allowing medical professionals who are in public service to work in the private sector as well. I don't think that's well managed to the extent that you do find public sector employees who are in private sector very early in the day.
Sure.
And there is also, on a similar basis, the shortage of nursing staff means that we have nursing staff who work in public service one day and the next at night they are in private sector. So there are lots of issues. The posts of interns that go unfilled, you tell us about that all the time. So on the workforce, there is a problem that we need to deal with.
And I think in many ways we've seen the challenges of the workforce and the pressures that they're under in the protests that we have seen, and healthcare workers really being incredibly vocal about some of the challenges that they're having to deal with on a day-to-day basis. I'm going to pause you there, Dr. Bhengu, and go to Christoff and also give him a chance to weigh in on this conversation. I think, Christoff, especially this issue of leadership, because it's coming out in both what Dr. Rajesh and Dr. Bhengu have said. What is the problem? Because if the people are qualified, if they've got the degrees, they're supposed to have the know-how. So what's the issue with the leadership in our healthcare sector?
Yeah, Kathy, I think that's an excellent question. I think my background is from a financing perspective. I spent most of my career in the domain of medical schemes, and kind of thinking about where the money comes from and where it goes, both in the private and the public sector. Now, to some degree, my diagnosis would be that around 2007, actually, at the Polokwane Elective Conference, national health insurance emerged as this overarching enormous reform that South Africa must embark upon. And perhaps inadvertently that has had some consequences in our ability to have effective leadership, make decisions and make policy changes as it's necessary. And I'll try to explain why. I think all of us agree. I think the first words you said this morning, Kathy, was something around universal health care, and a very interesting statistics that came up from the BHF conference last week was when Chai presented on some of the public hearings on the National Health Insurance Bill and suggested that something like 80% of respondents are in favour of universal health care, which should hardly be surprising. I think that's what all of us want, but only 20% of respondents were in favour of national health insurance as being the correct mechanism to achieve universal health care, because there are many ways that it could be achieved. The way that our government has chosen is one of centralized public sector control. It's almost like creating another quote-unquote SOE that will take charge of all of the healthcare financing in the country. Now, the reason that we've seen, very little positive development since then is, I think it's like a tale of two cities. We have these two very different creatures, the public and the private sector, both of them impacted on by this policy direction that we've decided to go on. In the public sector, I think Dr. Bhengu spoke exhaustively on service delivery, on poor management, on corruption. There are pockets of excellence in the public sector, I must emphasize that. But if you go to a public clinic and you look at all of the people queuing to receive primary health care, often not making it to the front of the queue, even if they've been waiting since 3 o'clock in the morning, you have to contend with the fact that it's failing in terms of the quality of care. In the private sector, there are so many low-hanging fruits, simple pieces of reform, Kathy, that I believe we could implement tomorrow that would enable medical schemes, insurers, administrators to extend low-cost cover to people who can't afford cover. I was listening to your Sibanye feature earlier this morning and thinking about the plight of households who cannot afford. Sibanye, of course, does provide comprehensive healthcare to all of its employees, but just thinking about a lower income segment of our population, it's very easy to implement a bunch of reforms that will allow us to extend cover to lower income South Africans in the private sector and alleviate the burden on the public sector. But I think my diagnosis is that because there's this enormous reform looming on the horizon, our leadership has been reticent and reluctant to make incremental fixes to the system. It's almost as if we've let the medical scheme and the policy environment to stall, I would say, for about 15 years now. And because we have this big bang reform kind of mindset, we haven't taken very small, obvious and simple incremental steps that could have been taken. And in the time we have, we might be able to touch on some of those obvious reforms that could be made.
We're talking about the sustainability of our local healthcare system and really just beginning with a diagnosis of where things are and what are the biggest challenges that face our healthcare system in the country. Dr. Rajesh Patel, Christoff Raath and Dr. Nthuthuko Bhengu are my guests for this morning. I'll be taking your calls within the next half hour of our conversation. For now, it's 10:30.